Good morning, everyone. Today we come to the second day of our faculty development. So, short while will we be starting about the day two, session one. Before that, I will just highlight a brief introduction about myself. So, for the first session today, I will be moderating. So, I'm Mrs. T. Linda Moy, Assistant Professor in the Assam Royal Global University, Guwahati, in the Department of Nursing. So today I can see some are still on the line joining. So as we still have some few minutes, within a short while, we will be starting the session. Okay, our today's session, session one speaker, we are Lakshmi Priyadarshini ma'am. Are you there? Ma'am, are you there?
Yes, ma'am. Yes, I'm here.
Okay. So I will start with the brief introduction about ma'am, respective ma'am for our session today. Our speaker for today's session, session one speaker for day two, we are Lakshmi Priyadarshini, is a distinguished nursing academic and leader with over 15 years of comprehensive experience in nursing education, administration, and clinical practice. Currently, ma'am is pursuing a PhD in mental health nursing, and she hold a dual. Excuse me 1 second. And she hold a dual master degree in nursing and psychology, complemented by the postgraduate diploma in hospital management, and also as a multiple certified training of the trainers TOT professional recognized by the government of India health bodies. She specialized in innovative teaching methodologies, curriculum development, and academic administration. Ma'am, credentials also includes a patent in the nursing education technology, multiple peer review publications, and a recognition as a national resource person for nursing capacity building programs. Her expertise spans academic leadership, serving as a vice principal, research, mentorship, mental health nursing, and integration of AI and simulation technologies in nursing education. She is also committed to advanced nursing education, nursing education through evidence-based practice and transformative teaching approaches. So over to you, ma'am. You can start with the session, ma'am.
Thank you, ma'am. Thank you, ma'am. You will be giving the slide, or shall I make it?
No, ma'am, you will be sharing the slide.
Okay,
Ma'am,
okay.
just
1 minute, ma'am. Ma'am, is it visible?
Yes,
Yes,
it's
ma'am.
visible, ma'am.
Yes. Ma'am, please help me how to fit in a page.
Ma'am, from your end, you just click on the next page, ma'am. You just go to the slide, ma'am.
Okay.
Yes. Click on the second page. Now it's okay, ma'am. Yeah.
Thank you. Thank you
Yes.
for giving a nice opportunity, and also I'm very fortunate to be in this forum in order to give some knowledge how to reproduce, how to write a research methodology in effective way, so that many of the people can reproduce our study in an effective manner. So thank you so much once again for the organizing team, especially for Mani Suhani ma'am, and also today I'm going to take a class, and also I'm going to give a brief notes regarding how we are going to present our research methodology in a research for a research article or a thesis, where we are going to where we are going to give our evidence based practice what we did in our research study. So why it does matter, and what is the need of giving a reproducibility of research methodology in a in a research, not only for nursing, for all the uh, disciplinary research. And the main reason is that it has a unique challenges in nursing research. For example, we didn't involve any other machines or any other non-living things. We involves human participants with the inherent variabilities, and we are going to give a complex intervention with the multiple components, and we are doing the research in a clinical settings with uncontrollable variables, and we are following some of the ethical constraints and non on standardization. So these are things we have to keep in our mind when we do our research thesis or research article, where we are going to where we are going to establish our findings, research findings. And why it matters, because when it becomes a poor research articles means, then there it have a consequences of poor reproducibility. For example, the particular research won't have a inconsistent clinical recommendations, wasted resources in reproducible studies, delayed implementation of evidence-based practice, and they do not have a proper ethical considerations, and there is an erosion of stress in the nursing science. For example, two studies on a pressure ulcer prevention with same intervention, so opposite result due to the undocumented variation in nursing assessment and the frequency. So these are the things we have to keep in mind while we do a research. The research methodology plays a vital role in a research study, and I can say it is heart of a research, because it is a vital thing. So what is the importance of methods and method section? So method section should be creditability, and it should be repeatability, and we can easily understand the result, what has happened, and the interpretation of the result, what is the scope of the future study of our research. So these are things we have to keep in mind when we do research methodology. So in all research thesis or research article or research publications, we will be following the IMRD structure, where the introduction part, which includes why did you start the study, and what is the reason for the study, and what is the need for the study. That and all has to become under the introduction part, as we know. And the methodology, what did you do, and where did you do, when did you do, what was, whom are the peoples have involved in the study, and what was the sample size, and everything for the all the question related to the research that can be answered in the research methodology section. And finally, R stands for research. And what did you find? The discussion part, what does it all mean, and what is the conclusion of the study. So what is the constitutes of the method sections, or identifying the data needs? What we are going to identify in a research study, and spelling out the research questions, and which involves formulating the recommendations, formulating the study objectives. That is, finally we will come to the conclusion, and we will be having a planning, analyzing. That is how we are going to analyze a study, and we will finally go for analysis of data and preparing the data collection instrument, that is called materials, and what material we are going to use, and whether it is standardized or structured, and everything that has to comes here. And finally we go for a data collection. Now methods includes is nothing but the planning, analysis data, preparing the data collection. Those are the things we have to keep in our mind when you do research methodology. The essential components of checklist we have to check when for the research methodology are the participant related elements. For example, we will have a inclusive and exclusive criteria. We should define a clear, concise, and precision in the inclusion and exclusion criteria, and that is recruitment of the procedures and the timeline, and what kind of the population you're going to use, from where you're going to draw the population, in that how you're going to take a sample size, whether you're going to do a retest method, or you are going to do a pilot study, or we can have a same study which can be replicated by someone else, and that study we can have a clue. From that we can take a sample size, and also we should have a justification. Why did you take a sample size, and what is the need for the sample size? For example, you are taking a sample size for 300, and we have to justify why you are going to take a 300. In 300 is constitute of, for example, for an experimental group, how many samples are there? For a control group, how many samples are that? You have to testify with the proper reason, and also the demographic characteristics, that what we are going to do in the that is we will do in the demographic variables, that and all should be clearly mentioned in the components of the research methodology. Next one is the intervention. The intervention is nothing but the detailed protocol. Some say, for example, some study will have a phase 1, phase 2, phase 3. They will have a intervention for the 3 phases, and that can be explained detailed, and training provided to the interventionist. Some interventionists with the lack of knowledge, they will be doing some intervention, but proper training to the has to be taken by the researcher, and then they can go for an intervention. And also in fidelity monitoring procedure, we have to maintain a confidentiality, that we can obtain informed consent, or whatever the letters related to, whatever the papers related to the ethical consideration, that has to be maintained carefully. And the control group description, as we are giving an importance to the experimental group, and we supposed to give a equal importance to the control group also, because what are all the matters we considering for experimental group, that we have to consider for the both control group also. And also, what is the measurement elements? What instrument you are going to do? What kind of questions you are going to do, and how it is validated with the psychometric testers, or everything, or anything, or whether you are going to take a standard questionnaires or standard tools, and that has to be mentioned clearly. The data collection procedure, maybe the data collection procedure may involve with the previous pilot study, and also the data collection procedure, which includes the intervention, how long you will be giving an introduction, what is the pre-test module, and what is the interventional stage, and how for the post-interventional stage. That and all should be mentioned here clearly. And also the timing for the measurement. So some study will lack, will have, for example, time series studies. It will take much time to, sorry for the disturbance. So timing of the measurements, that has to be mentioned clearly, and also personal qualifications. So here, whom are all the for example, the instruments or the materials that can be used or validated by the particular persons or by the experts, that and all we have to consider while doing the measurements elements. So what is the proposed subheadings for the method sections? Or here I already give a brief introduction related to the participant, design, material, and the procedure. Design setting is not the study setting, where you are going to do and what kind of design you are going to use, what kind of approach you are going to use, what sampling strategy you use. For example, for my study, I'll be using a convenient sample setting, complex sampling size types, or for somebody purpose, they will have a stratified sampling things and cluster. Whatever the strategy you can use, that has to be mentioned clearly in a research methodology. And this research sample size, I already told that by the previous study, or we can do a test-retest method, or the other sampling size calculating methods, and also the pilot study, that will help to define the proper sample size for your study. The study procedure and how long you will do, what is the pre-test question, what is the pre-test procedure, and what is the during intervention and the post-intervention stage. And here, whatever, while we doing some of the operational definition, that has to be taken, the definitions or the content in the operational definition has to be taken from a relevant and a trustful source. So that can be that cannot be given multiple issues to our studies. So data management, how it has been collected and how it has been analyzed, and how the human participant protection can be prevented. For example, ethical consideration, that is asked, but that we are obtaining a informed consent, or some of the ethical consideration, or ethical team will be looking after, and we have to get the permission from the ethical consideration departments. So format for your headings should be study design. So what type of design you'll be using, journal guidelines, from where you are taking the study, from which is the primary source for your study, and standard formatting styles. For example, many of the study are following the APS style for writing a research article or research for our thesis. So the participant selection, already we discussed. For example, what is a poor, for example, I'm going to give an example, interventional study, a poor documentation. Some will some will give a note down, like we recruited nurses from several hospitals from a stress reduction study. So it is a wrong. So reproducible documents, wrong statement. So reproducible documents such as inclusion criteria, the registered nurse with active license, employed is full-time license, greater than 36 hours per week in a medical surgical unit, minimum 6 months experience in current position, willing to participate in 8-week intervention. So these are the things we have to note down while we including the participant selection. Exclusive criteria, administrative or supervisory role, currently receiving psychological treatment, planned leave of absence during the studies, participant in other stress management programs, that are to be excluded in the exclusion criteria. So next, recruitment process, the hospital approved obtained from the 3 institutions, and that has to be used for an interventional stage. Information session scheduled on all shifts over 2 weeks. So voluntary sign up and informed consent obtained in a privates. Baseline assessment completed before randomization. For example, N is equal to 150. For example, we are going to take a 3 institutions, so 50 per site. So the power is 0.80 and the alpha value is 0.05 for the detecting 20% of the stress reductions. So control group specification for the comparative study example. The poor description is the control group received usual care. We should not give a vague manner that the control group received a usual care. Here in the reproducible description, which can be given, which can be explained in a control condition designation, that is usual care control group, or the content is standard diabetes education per clinic protocol. Formaters group, that is group session 8 to 10% patients per time, and the duration is 60 minutes for a single session. Providers are clinical nurse and not study trained. Materials or standard clinical handout packet follow up scheduled to the primary provider per usual protocol. So this is the key term we can use for our study for the control group description. So attention control group elements are equal number of contacts with research team. So how the
Arpita,
how
can you come
how
on mute?
now how many people, how many sample you taken in the experimental group, that has to be equally shared in the control group also. Equivalent time constraint has to be maintained for the both groups. Similar outcome measurement has to be scheduled. Blinded research assistant for data collections. Rational. What is the operation for for this? Because the control for attention and assessment for the effect while testing specific intervention components. So we should not give a bias to the control group and the experimental group. And the study design, keep the terminology appropriate. Analytical cohort study, for example, we have to give a, whether it is a randomized control study or it is a prospective randomized control study, or it is a randomized control study case or control study, or quantitative or qualitative study. In that you can mention the survey method or whatever thing that has to be specifically termed as in a appropriate manner. Justify the need for the mixed method design. So for example, if somebody will have need to use a mixed method design, so in that we can mention that we conducted an analytical cross sectional study, like that we can mention. So in the operational definition, what does a given term means in your study? For example, we will be writing a below poverty line people, like that. So it can be mentioned as a monthly household income less than rupees 6,000 was operationally defined as a poverty line. So you can mention, you can describe in a proper terminology. So standard definition has to be followed. Standard resource from where you have taken the operational definition aligns the reader's interpretation, enables the comparison with the existing literature. So everything has to be noted down while we writing down the operational definition. So next, the sampling strategy and the sampling size. Report all the assumptions and the calculations and justification as for our assumption. For example, here we are given a example for a study. We had recruit 55 COVID patient positive, COVID-19 positives and 165 COVID-19 negative individual. Our assumptions are prevalence of self-reported loss of smell, taste of 25% among COVID-19 positive based on the case series unpublished, and self-report loss of smell, taste through telephonic interview of the COVID-19 individual, and 5% of the COVID-19 negative persons alpha error, that is 5% on 1:3 allocation ratio. So where there the people have a 19% of the people, they face that smell, taste, they have a there is a variation in the taste. So we can mention a proper description for our sampling strategy and what you did, what was the major thing you have find out in your study, that has to be mentioned here. So non-responsive of the 20%. So for only 5% have similar changes in the negative percent. So we have to mention such condition in a non-responsive of 20%. So we enrolled all the eligible study participant consecutively from 2 COVID-19 samples centers until desired sample was achieved. Until we received a desired sample size, we have to check out with the other sampling centers also. So study procedure, every steps along with the way we have to mention in the study procedure, and the reference for the standardized procedure if there is you have. For example, in that here, the testing material, we completed clinical examination for the loss of smell, taste ahead of sample selection for COVID-19 testing center. The standardization procedure used for preparation of solution and the test were based on the DDONG's neurological examination. The particular standardization procedure has to be mentioned, whether you have a reference with the other study similar to your study, that can be mentioned here with a proper references, which should be a standardized procedure that can be replicated in our studies. So for example, which was explained in the box 1, the standardization of test kits and the procedure for testing the smell and the taste. So those some of these A11 concentration, asafoetida, eucalyptus oil, salt, sugar, and that and all used to find out the COVID-19 the patients, in order to identify the smell of taste and the smell of it. So this is a standardized thing which I gave an example for this. So next, some of the algorithm we will be using for the summarizing the information. So here in the NFHS, then 4 samples is stratified, 2-stage sample, that how you taken a stratified sample, that is PSV, where villages in the rural, that is in the urban area, and how the rural and urban area people are clustered in a thing, and how the total sample was derived from the ever married women, and totally how total women you selected for your group and the total men of the group. Like that, you have to use the this algorithm. This is an example for the algorithm which we are used to for what we can use in our previous forthcoming studies. Example of this. So how many records you will be used for a data searching, and in that how many record is used for you, that has to be maintained, and what are all the removal of duplicate records or related to your study. And finally, from 120 to 124, only 114 records has been screened. In that, 106 are record excluded, only 7 in that you included. Like that, the protocols has been explained very well, so that the researcher, those who are coming to the young researchers may have a knowledge, and then they will be used in their study. So for this is some of the algorithm that can be used in a study also. So next, data management collections. We list all the tools and the techniques, data entries, data and validations. The data were collected in a 2 part. For example, I'm going to give an example. So data were collected in a 2 parts. Face-to-face data collection, minimal detection details, clinical examination were conducted at the sample collection center for COVID-19. This is followed by the telephonic interview on the same day. After inquiring about the history of new onset loss of smell and the taste in the past 14 days, the participants were clinically the loss of smell and the taste using standardized test, where we are already discussed with the standardized test like that. So a proper discussion has to be given. Following the trained interview, the telephone contacted participants to collect the data on structured question. What kind of questions they be using? Developed using a open data kit application in order to limiting the delimitations, like collecting the data prior to the declaration of COVID-19 results. So finally, a clear cut of data management has to be established in your study. So data management analysis, where we will be using in our study, we will be simply telling that we use just descriptive statistic method and analytic statistic method like that, and statistical test and p-value, confidence interval, and some of the software also we can use for our analysis of data. So data analysis, the socio-economic, the specifically for the example study, they used a Fisher exact test. So in order to identify the data analysis, they used a particular analytic statistic method. So in our study also we have to mention whether it is a p test or a t test or ANOVA test, whatever things that has to be mentioned clearly. So in the method already we discussed the objective. For example, I'm going to give an example here to mention the objective to measure the prevalence of self-reported loss of smell. The design is cross-sectional design. The participant, all the adult reporting the COVID-19 test. Indicators of the proportion of COVID tested participant with the anosmia. The data collection methods: interview, data collection tool is questionnaire. So human participant protection, I already told that. There is ethical committee board will be there, and the name of the board is IHEC board. The numbers not in the manuscript without identifier, the specific measure taken to protect the human participants, deviation from the protocols. Here for the that is ICMR, National Institute of Epidemiology, they mentioned that every participants will undergo the institutional human ethic consideration board before conducting to the study. So for example, it is there in Chennai. For Tamil Nadu, it is there in Chennai. We obtained the verbal informed consent from the participants. That is, we will be obtaining an informed consent form, will giving and getting a sign from the participant before conducting the study. So what is the methods we will, the do's that can be followed are edit protocol properly, that is turn future tense into past tense. We should not use a future tense, it should be a past tense because we have done a study. So structures the sections in a proper way, describe what was done, and quote only the key references, describe the method what used. For example, a sampling methodology paper. So what are the don'ts we should not use? Means we should not use a passive voice, we should not provide a result. The number of participants includes in a result. Do not provide excessive details of information collected. Do not list out every question on the instrument, and list out the broad category of information collected. Explain rather than the label. So we should not we should not give a labeling. We can explain it properly. So we selected a person among visitors of the local market, the local shop, and the healthcare facility. So it is properly explained. We took a convenient sampling of the population. So it cannot be used like this. So, and the method checklist, does it describes what question were being asked, what was being tested, how reliable was the instruments, like that questions which has to be checklist. We have to then and there ask the we have to then and there ask the question to us, and according to that we have to act. Where the parameters recorded and analyzed correctly, would the reader able to repeat the same experiment for the future? That kind of questions we have to have a checklist. So take home message here. Till now we have discussed about what kind of the research methodology includes, our research method approaches, research design, and how we are going to draw a sample from the population, what kind of type of design you are going to adapt for a study, and what is the material you are going to use in the material, whether it is a questionnaire or a standardized tool, whether the questionnaires constitute of all the need of the study, or that has to be find out, and also the human consideration, human ethical consideration, the proper confidentiality maintaining. So proper data collection procedure, properly maintaining the sample size calculation methods, and proper description of the things in our research study. So describe where we study about the objective of the study sequential, and how the methods under suggested subheadings being scientific but avoid judgments. Then remember, it reflects on the credibility and the reliability. When our study success means when our study was taken by someone else, or what it can be replicated by someone else, and also where we are, where our in future our study can be quoted in the study. That time only the researcher have a credit to their studies. So, and also it can be used for an evidence-based practice also. So this gives a credit for our study. Critically review the method section of an article. Finally, we saw the identifying the standard errors, what is the proposed changes, and the method to answer all the objectives of the question, and all the question arises while doing the research. The flag missings, unnecessary elements, that and all should be avoided. Go through the list of do's and not and don'ts, propose solution changes, and stylistic issues like following the standard style method like API styles or for our studies. So while completing our research methodology, we have to have, every time we should have a checklist, practical checklist, that is pre-submission verifications, study design elements, whether it is explained in a proper way, framework, ethical approval documented, participant information such as justified, whether it is justified clearly, eligibility, completed, recruitment detail, constant process described in the measurements, whether the instruments or psychometric measurements or the standardized or self-structured or whatever the questionnaires used, administration protocol specified in the analyzing transparency, what are the software you used, what the test you used, and what is the missing data handling and assumption verified, that and all you should be note down. And quality standards documentation, whether you are documented with everything, and training protocols, quality check implements, reliability, deviations record, what are all the extraneous variables you found out in a study, and that and all can be documented in a quality standard. The data management, how you stored your data, the storage system security, auditing the maintenance, sharing plans, documented, retention schedule cleared, supplemented medicines such as protocol availabilities, instruments, accessibility, coding schemes, and analysis code shared. Everything that has to be checked while doing the research methodology. So some of the common issues you face in that reproducibility in the methodology sessions are, that is vague participant description. Some we fail to describe in a, that is inclusion criteria and exclusion criteria won't be precision, and we will be omitting the demographic details and providing insufficient information about the sampling method, and this prevents others researchers assembling comparable participant groups. So incomplete procedure details, and also that is a lack of data collecting procedures may give you a wrong result also. It gives a vague to our study. So they describe the intervention, data collection terms, the general terms which you used without specifying the timing, frequency, duration, exact procedure, missing operational definition, making replication virtually impossible. So inadequate instrument documentation, such as a proper, we should not using a proper tool without providing version numbers, validation details, scoring procedures, psychometric properties, ambiguity undermines the reliability of the study, and finally, unclear statistical approach, omitting software versions, using a specific statistic, assumption checked, handling of missed data. These gaps prevent verification of analytical decision and result interpretation. So, thank you. I think I may give because research methodology is a vast thing and it is a ocean, and I have covered some of these things. And once again, I thank the organizing team for giving an opportunity. Thank you, ma'am.
Thank you, ma'am. Yes. Thank you,
Yeah,
ma'am, for
continue,
your
ma'am.
wonderful session. Thank you, ma'am, for your wonderful session and in-depth coverage on methodology and design. And we are very much grateful for your wonderful presentation, ma'am. So now I hand it over to the next session to Mani, ma'am. Over to you, Mani, ma'am.
Thank you very much, Linda ma'am and Priyadarshini ma'am, for this wonderful session. So we will continue with the second part of this today's session. So the second
Yes.
part would be taken by Professor Purna Venikeshwan ma'am. She is a senior nursing academician. She is pursuing PhD and currently working as a principal and head of psychiatric nursing department in Santosh Institute of Nursing and Research, Bangalore. Even she is having 22 years of combined clinical and academic experience, including international exposures across India, Sri Lanka, and Malaysia. She is an accomplished CBT trainer with recognized expertise in psychiatric nursing, academic leadership, and curriculum development. Even she has published research papers in peer-reviewed national and international journals and has served as a guest speaker in academic and professional conferences, contributing actively to the advancement of mental health nursing education and practice. So today's topic for Purnaveni ma'am is the IMRAD framework, that is deep dive into the standard flow of a paper. So it's over to you, Purnaveni ma'am.
Very good morning, ma'am. I'm very glad to meet you all. And once again, my sincere thanks to Manisha ma'am, as well as JR Foundation and all the scholars and the teachers, professors who all gathered for a wonderful setup here. So, ma'am, I hope my PPT is visible. If it is not, please let me know.
It's not visible now, ma'am.
It's visible, ma'am. My PPT is visible.
No.
Just a minute, ma'am. Let me share the screen.
Yeah, sure, ma'am. Ma'am, try to share the screen again, ma'am.
Ma'am, I think now it is showing. Am I right?
Yeah. Yes, ma'am. Not showing,
Yeah.
ma'am.
Okay, ma'am. So, ma'am, myself, as Manisha ma'am said, I'm working. My name is Purna Venikeshwan, and I'm working as a principal in Santosh Institute of Nursing. So today, ma'am was assigned to take, given me a topic out IMRD, because this is the basic foundation, and it's just a deep dive into the standard structural flow of the paper. So once again, I will maximize my screen so that everyone can see. Yeah.
Ma'am, you have to exit the page and you have to go for PPT.
Okay, ma'am.
Escape.
1 minute, ma'am. 1 minute.
Yes, ma'am.
Just a minute. Just a minute. Now it is visible, ma'am.
No, ma'am, no.
Now, ma'am.
Yeah.
Yes, it's
Yeah.
visible.
Okay, ma'am. So here, if you see the objectives of this IMRD, because we are all researchers and research scholars, we do came from many type of field, like in the nursing field, in other disciplines also. So before starting this IMRD, we need to know what are the objectives we are going to see for the next half an hour to 45 minutes. So here the objectives may be the understand the logic behind the IMRD. Mainly the logic, because to start something in the beginning, we need to understand the background of what we are going to proceed, and to identify the second purpose is the purpose of each IMRD. So IMRD, each one thing has having specific criteria in the section, and as well as we need to avoid some common structural errors in the research papers. So common research errors, especially mainly in the structural basics we are presenting, so that should be avoided in such a way, and apply IMRD effectively in the academic writing also, because at the end our main aim is to present IMRD in an effective way, so that the publishers should accept our IMRD without any delay. So if you go to the third slide, what are the importance of the research paper present structure? So that is mainly we are focusing. They have the presentation and the rigor. Rigor is nothing but we are going to repeat, see that whether the content was selected meticulously to evaluate the quality of our research. The presentation in which way we are going to present. So we are going to see one by one by the upcoming slides. And especially the structure is not in a systematic way. Definitely, sometimes the inadequate structure may result in confusion among the reviewers. Whenever we are giving our after the scientific paper was prepared by us, by the researchers, and when we are giving our paper for the reviewers, especially, they should not get the confusion. By even seeing our paper, the standard format should be there. they should get what we are trying to tell. No need for further explanation. But when they're seeing our presentation, they should get a strong idea they should come to know what we are going to explain. And the second aspect, if you see, is desk rejection. It is here mainly our submission was rejected by any of the editors. For example, many ROL, review of literature, which is coming in the same idea or same studies or else copied from the previous experts in such a scenario, the desk rejections can happen. So what we're going to do here is a standard framework enhances readability and also reproducibility. So it should be well clear. And so when in the future, suppose this year I'm conducting a research work, means after many years, my juniors or anyone is going to take my study as a reference, means they should not get any confusion. So my research study should be a boosting and a part of in their study also. So how we are going to write the ROL, like this so and so author explain these things like that, it should be there. So there should be minimal confusion in the reproductivity as well as the readaptability. Now the main picture we came here. So the IMRD framework, what is it? Well, we all know it is nothing but, see, we are all nurses, okay? We are all in the nursing field. So exactly whenever in my professional life or personal life, I'm always taking this nursing diagnosis, the pie chart, or else you can tell SOAP, whatever it is, the same thing only here also. So I stands for introduction and M stands for methods and results and discussion. So this is a basic foundation of the framework where we are going to write the systemic paper. So usually, apart from that, nowadays, not only in our discipline, many disciplines, they came across after seeing our medical disciplines. They are also coming forward to implement a lot of research papers. Okay, example, STEM. STEM is nothing but science, technology, and engineering and mathematics. So they also implemented many things. For example, when we are writing the research papers based on the APA manual, the bibliography or whatever it is we are writing based on the APA manual, the same thing, they also have the criteria to how to write the research papers. So medicine, of course, medicine and other disciplines like nursing, allied health science, pharmacy, physiotherapy, whatever it is, we are sticking to the APA format. So apart from that, other disciplines like history, commerce, whatever it is, they are going to stick to the other type of format. That format should be accepted globally. So that is very, very mandatory here. So we should always compare that IMRD along with the protocols, what we are going to follow exactly. Now, a small this one. Correlation between the scientific thinking and the paper section. So scientific thinking, mainly here the problem identification. Here as a nurse, first of all, we are going to identify what the exact problem. So that problem identification we are converting into paper section as introduction. Okay, our theory, our what is the study, whether am I capable to take the study, how much time it will take, how much budget it will take. So how much, what are the samples I'm going to take, either human samples or whatever samples, psychological study or else any medical study. In such a way we are going to correlate. So that is nothing but the problem identification. And second thing is experimentation. That is nothing but the methods. So here the methods can be done. For example, small example, we are nurses, we may know. For example, to increase the a patient's or women hemoglobin, we all know that when she is consuming beetroot juice for at least 1 month, the HB will be automatically will go. So that is the experiment which we are going to do in the women. At the same time, the methods, what type of methods we are going to do, that is very, very important here. Either we are going for a designs, what type of designs, like only one test we are going to take, or else we are going to take the control group, like quasi study type pattern we are going to take, or only the interventions we are going to give, or randomly we are taking. So all the type of things will be coming under the methods category. And once these two things is done, our duty is to observe. Observe is nothing but in scientific thinking, how we are observing, the same thing will come in the research criteria. How whether the hemoglobin was increased, how was the lady's health, she's able to go for a work, the fatigue is there. In such a scenario, we are going to focus in the research criteria. And next is the interpretation and the discussion. Yes, once done, we know, suppose for example, I said quasi study. For example, control study, you know that we are not going to implement any type of interpretation, but experiment group, we are going to give some intervention means like a beetroot juice, or apart from that honey, lemon, whatever it is, which is a stimulant for that to increase the hemoglobin. In that, how we can going to discuss based on the Scopus format or IMIG format, we are going to discuss. So this all will be coming in the scientific paper for publication. Overall structure follow for the IMRD format. So here the transacting from the gender to specific to gender. Yes, here generally we are going to see, for example, the population from where we are going to take, how we are going to take the introduction, methods, research, results, and discussion. We are going to take the same general, and to the specific, again to the specific, again we are going to categorize in the discussion and to the general level. So the general, again I have mentioned here the general. This general is nothing but in the future. In the future, how I am contributing my factors to the young researchers, in which other way they can take my study, how my study was useful for them to implement storytelling of research. Yes, definitely. I do agree with this, because the research is not nothing but taking a paper and writing something and publishing. It is like it's an art. It's art of telling something. When someone is seeing your research paper, they themselves should have the interest to see that what you're going to present, what you're going to try to tell. So as I said, an unstructured research may cause confusion in the peer reviews, and desk rejection can happen. So to prevent that only, our logically storytelling type of skill should be developed, but we cannot go until in our absence, our paper should present in such a way. And each section responds to a different query. Why, how, what, and what does that mean? So why we are doing this research, whether this specific research is going to help the society, and how I'm going to do, what type of the methods, what are designs, those things, those should be involved in the how category, and what. Why I'm doing this research, what type of research I'm going to do, in what way it is going to help my juniors, and what does they exactly mean. As I said, gender to specific to gender. In that criteria, whether it's correlative, that should be followed by the each researchers. So we are going to see IMRD format. So first one, introduction. So introduction is like purpose. Why does the study exist? Establish research context, whether the context is framed in such a way. Before starting the research, we always used to go to the history, the background. That is nothing but a ROL, the relevant review of literature. Whether if we have the variables like independent variables and dependent variables, the both variables correlating with the review of literature, that we are going to collect it. Because I'm just wondering, the 2-3 decades back and all, anyway, the invention of computer happened. But if you are taking the 80s and 90s, early 90s and all, I'm just wondering how those researchers have implemented such a review of literature without any scientific technology. Now, anything we can get within a hand, because we have good mobiles, we have good technology, social media, everything is there. Whatever we want, we can get in our hand very easily. But just sometimes I'm wondering how they would have made, where they would have studied everything. So the review of literature matters a lot here. It is just giving you an idea for the researcher, each researcher, to implement and to grab the points from where they can take and where in which way they can arrange the ROL. And third thing is identify the research gap. Yes, the gap between the years, the gap between the study format, the methods. See, when you're reading the ROL, when we'll come to know, especially what type of methods they have selected here. Some difference we can identify, because when I'm doing research activity and all, I used to see in one author maybe selected in one designs like only one test design. Some author may be preferred to the quasi design. So why this particular author have selected this researcher, this quasi type of design, what he's trying to tell, and why only that person have selected one test at a time, like that. So that's a research gap we can identify very easily. And well and good, our last one is define objectives, whether we should always focus that objectives and hypothesis are correlating along with our problem statement. So it's a funnel strip, nothing but our funnel strip structure. So majority of many ladies are here. We ladies always will be in the kitchen, and we know how the funnel structure. Okay, the very first month when we get the salary, we used to spend a lot and we used to give nice dishes for your family. Then when the month ends, we won't have that much interest to prepare something. So same we are also here also. We can apply here. So first one, if you see the broad background should be there. Okay, what type of study we are going to see. Suppose if I'm taking some cognitive behavior therapy, means my study before starting that, I should have lot of knowledge. I should search for lot of things about the psychotherapy. because this cognitive behavior therapy is one part of psychotherapy. So I should have the broad background knowledge. I'm able to capable of doing those things. The thing is existing knowledge. The current knowledge I should always correlate with the other knowledge. Okay, the existing knowledge with how I can implement those changes and what are things I can grab it. And I'm with a gap in only the psychotherapy is having only cognitive behavior therapy. Why I'm preferring only the specific therapy that I should be identified. And research question and aim. Research question is nothing but the aim, the objectives which we are focusing, that should be monitored pakka. Monitored pakka. So that is a research question and aim. And last is research question and aim also. This also should always correlate with our objectives. Because this question, as we have seen in the third or fourth slide, how, what, when, and what did that mean? So that should be always get with the research question and the aim. And last is nothing but our hypothesis. This is the main thing. Once we are touching this hypothesis, at least we can breathe that our study is going in a perfect way. So methods. How was the study conducted? As I said, the population, the samplings, and what type of intervention we are going to do. Am I going to give you some intervention? And demonstrate rigor and transparency. That is very carefully we should show that, and there should not be any hidden factor. So even collecting the samples also will be should be very transparent. And it should always, as before me, ma'am said about the ethical consideration. So the transparency should be there. A legal, ethical consideration should be taken well in advance. And that should not be, when we are finishing this demonstration rigor and transparency, that always will implement to enable replication. Enable replication, again, after some years, my juniors are taking the study and repeating the study again. More or less, they should get the same type of results. So that's the replication. And establish credibility of the results. Then they can take my study as their ROI also. It's my study is giving some contributing factor for their study. And the key components, if you see, the study design. Okay, well and good, we should always focus on the study design. What type of design? I have seen many of my students and colleagues also. Sometimes they will select one design which they cannot even complete. After starting that study, when the study is on the midway, they want to change the design. So it's a like just we are wasting our time. Okay, before starting the study only, we should have the thorough knowledge what type of design we are going to do. I'm going to descriptive study. I'm going to experimental study. I'm going to give you any intervention there type of things. That should be well planned. So if it is not planning in such a way, we cannot implement these methods. And the sample and participants. Yes, of course, this is the major breadwinner for us. So these people will be sampling and participants should always will be well informed regarding the study. Like any ethical consideration we are doing in such a way, that should be implemented well in advance, and that should be taken in such a way. And what type of tools we are using, instruments and tools, whether the tools was approved by the specific APA, okay, under American Psychiatric Association, they have taken or what, because my base is psychiatry, that's why I'm taking about psychiatry, okay. So it was taken by the American Psychiatric Association, or any other things was implemented by the any Journal of Nursing, they have implemented. So instruments and tools should be structured in such a way, and we should get the validity from the experts, and then we can proceed. And data collection first also we should formulate it. Before yesterday also when ma'am was given a vast knowledge. Okay, yesterday she gave a vast knowledge how we are supposed to collect the data. Data collection, how we can collect it. We can plan accordingly. Exactly some time framework for the pilot study and for the main study. Like this week, I'm going to prepare my day. I'm going to select my samples and participants, and next week I'm going to prepare my tools, and I'm going to get the content validity, and the upcoming week I'm going to prepare the data collection. There I'm going to get the data collection after getting the permission from the each institution. And data analysis techniques, this is a very thing. It needs some quite patience to do this data analysis techniques. Here, what type of statistical and inferential data we are going to implement, that should be, thoroughly well known to the each researcher, so that they can implement in a nice way. And ethical approval, this is very important, because this is like we cannot do any research activity without any ethical approval. Ethical approval matters a lot here, unless if you are with the participant should be well informed and the consent should be obtained. We are giving authority, and we are just taking that whole responsibility that we are not going to cause any harm, especially the studies like clinical trials, when we are using the placebo type of trials and all. We should definitely get the ethical approval from the institution as well as from the participants. And the results. This is the purpose. Why did the study find? What study find? After doing the study, what exactly I was finding? Whether did I achieve all my objectives, was satisfied by me, or all the objectives fulfilled by me, that should be noticed. And the objective presentation of the findings. So once we have done the study, we should always see we may have 5 to 6 objectives, that all the 5-6 objectives should be fulfilled after the once we are getting the results. And directly answer the research questions. In which way we can directly answer research questions, especially it is where the question format which we have made prior starting this research activity, that should be directly answer research questions and no interpretation or explanation further. That should be made in the results. So reporting style. So we all know there's a chapter of 5 and 4, and on 4 and 5 we are going to make this. So organized as per the objectives and hypothesis, mainly we are using tables, figures, statistical values, highlight patterns and not opinions. We are just to mentioning the we cannot, as a researcher, I cannot give my opinion, but highlight the patterns in which way my study is helpful for the nursing administration, nursing education, and my own specialty, how in which other terms it's going to help. So once we are starting this type of learning, especially the tables, figures, and statistical values, we'll come to know in which other way we can reproduce our results in IMRD format. And last is discussion. So what do the results mean? Interpret findings, whether the findings in the statistical data is relating to the objectives which I have formulated in the beginning and relate the results to the previous studies. So previous when we took that ROL, we had an idea, right? So whether my current findings is correlated with the ROL by my experts, the previous experts, it was related or what, that should be discussed in the discussion criteria, and explain the significance and implications. Okay, the importance of nursing field, administration, and service, everything should be implemented. In which other way we can implement the discussion in further way to catch out the young researchers to come forward to do this research study in the future. So summary of the key, if you see the discussion standard flow, the summary of the key findings, especially the interpretation of the results, we are using wide type of things, like a PAD test, TPAD test in the statistical format we have, and the comparison with the literature. As I said before, the previous slide only I said, just to correlate with the ROL and see that what type of the methods they have done, what type of interprets they have found out there, that those things is interpreting with your results, whether it's correlating. At the same time, make sure that your objectives are met in such a way. And implications both in theoretical and practical aspects and limitation of study. Yes, this is very, very important because delimitation should not go there. So one day the limitation of study, how much participants we are taking, the sampling size, the sampling area, everything should be well planned, and the study should be those samplings are presented towards the study should be checked, and any information you're giving, how you're going to implement or how you're going to check the feedback from the participant, that is also mentioned in the limitation of the study. And as again I'm telling the scope for the future research, my study in which way it is going to give a scope for the future research. So we are all working for our juniors. Okay, upcoming generation should take our research study and they should make they should keep our study as a foundation. How I said IMRD is a foundation, like that they should take our study as a foundation and they should implement in such a way. And the last slide is a logical framework, not just a format. Yes, it's a logical framework. It's a globally accepted. It's a logical framework. So each section has a clear non-overlapping rule. When you're creating chapter 1 introduction, chapter 2 ROL, chapter 3 methods, whatever it is, it should be very clear and concise way and not overlapping rule with each other. So we should have a research should have the sound knowledge in which way they are going to present the scripts. And strong structure and strengthens research impact, and mastering IMRD improves the publication success. So this mastering IMRD mainly when this all the formats like IMRD, all introduction, methods, research, and discussion, or everything is in a perfect way, then we can go for the publication success. Otherwise, again we are going to get for the correction. So that should be totally avoided, and to prevent the wasting of the time, we can go to the IMRD process in a perfect way. So any doubts if you have, you can ask, and I would like to because here many experts are there, so we are all in learning stage. If anyone speakers are there, they can also contribute some points so that other people will gain. Even I can gain something from you people which I'm not familiar. So this session is open for the contribute. So anyone can contribute. So well and good, we can all understand this things. Now session is open for contribution. You can contribute.
So I would like to ask Steffi ma'am to contribute for this. Steffi ma'am, Steffi Abraham ma'am, are you there? Steffi Abraham ma'am. I think ma'am, she is not available.
Any other volunteers can contribute, ma'am. No issue.
Yes. Let me check the names and then only. Linda ma'am, Lakshmi ma'am, Kavita Pal ma'am, Jaya Bharti ma'am. And even I think Vineet Ramawat sir is also over here. So I would like to ask Vineet sir also to contribute for this session. Okay, I think they might be busy. So any other people, they are having any queries?
Ma'am, any queries you can ask also. I'm very happy to share your doubts.
I think no one is having any queries, ma'am.
Okay, ma'am. Okay.
Yeah. So
Ma'am.
The session was wonderful, Purna ma'am.
Thank you,
Even
ma'am.
I have also learned many things from this, because sometimes while maintaining this IMRD, we used to have many problems.
Yes, ma'am. Yes, ma'am. We are,
We
ma'am, we
as
are all
a-
nurses only, but sometimes what we are doing, the based on the nursing assessment, SOPIR format that we are keeping in our mind, this is also very easy, ma'am. Because I'm keeping that SOPIR format in my mind, subjective, objective, assessment, planning, implementation, those things. The same thing only I'm keeping here. So it's very useful for me, my personal experience in IMRD format. So finally, I want to thank Madam Manisha ma'am and GR Foundation for arranging this wonderful opportunity and trusting in me that I can implement something research activity in the along with the many experts are here and upcoming learners, scholars, everyone was here. So I'm very happy to share my knowledge, and I would like to pray for everyone. My blessings and prayers for all the scholars and the learners. Thank you, ma'am.
Thank you, ma'am. So we will wind up today's session, ma'am. Thank you for this wonderful session. Okay. Have
Thank
a good
you.
day, everyone.
Yeah, ma'am. You too, ma'am. You all too, ma'am.
Oh, bye, ma'am.